Hello, and thank you for tuning into the first of our video series, Anesthesiology Survey Readiness, aimed at guiding anesthesia teams through the survey process. I'm Alicia Sicoli, Somnia's Manager of Accreditation and an ASAT certified anesthesia technician with a decade of clinical and administrative experience who's been part of numerous accreditation surveys. It is my job to identify and verify the compliance of our teams with established state and federal regulations, correcting any noted deficiencies that might exist at client facilities through policy, training, or other measures to ensure patient safety. Now, I'm sure some of you don't envy me in this position. However, when you're properly prepared, it's not as daunting a task as it might sound. In this series, you'll learn how to stay in a steady state of survey readiness. Each short video will highlight a particular compliance standard or other new development on the survey front. Today, I'm going to help you and others on your team get ready to wow your survey inspectors. Now, before we get started, can you identify any compliance issues in my picture? If you didn't find anything wrong, let me help you with that. An AORN standard states, do not wear used masks hanging around the neck. The reason for this is that the filter portion of the surgical mask harbors bacteria, and if hanging around the neck, the contaminated mask may cross-contaminate the attire. Make sure to keep following along for more tips. The following are brief overviews of various regulatory bodies and tips on getting started with your team's preparation for its next survey visit. It's important to always remember that if you equip your departments with a solid foundation, resources, and guidance, when a survey team finally arrives, there will be no reason to panic. So who creates the rules and regulations we must follow? The Centers for Medicare and Medicaid Services, more commonly known as CMS. CMS developed the Conditions of Participation, COPs, and Conditions for Coverage, CFCs, that lay the foundation for improving quality and protecting the health and safety of all patients. All healthcare organizations must meet these COPs and CFCs to earn what is known as deemed status, which allows them to participate in and receive federal payment from CMS programs. Deemed status can be conferred by either the CMS directly or by another authorized deeming agency like the Joint Commission. Other authorized deeming agencies include, but may not be limited to, the ACHC, formerly known as HFAP, DNV Healthcare, and the AAAHC. In simple terms, being deemed by one of those agencies means that an ASC or hospital not only meets but exceeds the expectations set out in the COPs and CFCs. Remember, if your healthcare organization wants to participate in and receive federal payment from Medicare or Medicaid programs, it must be certified as compliant with these specific standards. Since the Joint Commission is the most popular accreditation agency, we'll focus on them for now. In their words, the Joint Commission enterprise is a global driver of quality improvement and patient safety in healthcare. Their standards set reasonable, achievable, and surveyable expectations for organizational performance. Yes, you did hear that correctly. So we can all agree that these expectations don't always seem reasonable. However, what these videos will demonstrate is that with the right preparation, they are definitely achievable. Now that we have covered the who and the why, let's get started. Since being prepared is a priority when expecting a regulatory visit, let's make that happen with the following steps. Step 1. First and foremost, you need to know all the standards your team is required to be following. Having a copy of the Conditions of Participation and the Joint Commission's Comprehensive Accreditation Manual is a great starting point. Step 2. Determine where the gaps between the required standards and your current practice are so you can laser focus your remediation efforts. For example, is your anesthesia consent process up to snuff? If not, what can you do to modify or correct any deficiencies before your survey? Step 3. If you haven't already, implement morning safety briefings and use this time to update or remind staff of policies and procedures they should be following, what changes they can expect, and what the expectations are moving forward. Remember to allow time for open communication and feedback from staff about what challenges they are currently facing and what is working well. No one is better suited to point out difficulties following processes or identifying a flawed process design than staff members who are actually following them. Step 4. Stay on top of things. Create a binder with applicable policies and procedures and keep it in a central, easily accessible location so every member of the team knows where it is and can reference it at any time. Don't forget, collaboration is the key to success. Step 5. Consider holding an unannounced mock survey. It helps because bad habits die hard. Sometimes it's difficult to identify areas at risk of citation because suboptimal processes have become the norm, and just the way we've always done things. Use a third party, someone with a fresh set of eyes who is aware of current standards and who can not only identify areas of risk within your team, but also can help you work through them before your official survey or inspection. Step 6. Identify an anesthesia contact person. The most common choices are either the medical director or chief CRNA. Now that you've done that, you also want to identify who will pull all of the documentation that you'll need. Your on-site anesthesia administrator or office coordinator is a safe bet. Keep in mind that it is always a good idea to have a backup in mind, someone who is brought up to speed in the absence of the individuals you've previously identified. Now when the survey team arrives, don't panic. You've taken the 6 steps. You've got this. You've got a plan. It is also helpful to remember the 4 R's when being asked a question. Relax. Take a deep breath. Don't get nervous. Take a few seconds to organize your thoughts. Rephrase. Ask the surveyor to rephrase or repeat the question if you do not understand. Resources. If you are unsure of an answer but know where to find it, tell the surveyor you will get the answer. Refer to your policies or managers when needed. Respond. Answer the question as best as you can. Be brief and to the point, but never give more information than what they asked you for. Well, that about wraps up the first in our video series designed to guide you through a successful survey visit. At Somnia, we appreciate feedback because we understand that ongoing performance improvement depends upon it. If you have questions or observations about the content contained in this video, or if you would like to see other survey-related topics covered, please feel free to reach out to me at the email on screen. I'd love to hear from you. See you in the next episode of Anesthesiology Survey Readiness,